awesome Audra RN, and I'm coming to you with yet another video on my YouTube channel. Thank you for tuning in, and as the old saying goes, let's get into it. So today's video is basically about something that has passed about 5.5 months ago. It is about Nurses Week, and it is about nurses that aren't getting their flowers in nursing. So first of all, I'm going to tell you just a little bit about myself in nursing. And I'm going to use some cue cards where I've taken some notes, because I've talked to a lot of nurses and they've experienced not being appreciated, being underpaid, overworked, and undervalued. So basically, I'm a registered nurse. I went to school in South Jersey. I graduated in 2006. My first job out of college was in med-surg telemetry, and I've done everything from psychiatric nursing to being a supervisor in pediatric home care, a supervisor in skilled nursing facilities, and assistant nursing director. So basically, the reason why I'm coming to you to do this video is because for 18 years, I've never really gotten anything for Nurses Week. And a lot of the other nurses, whether it be an LPN, an RN, a nurse practitioner, a nurse anesthetist, assistant nursing director, a unit manager nurse, or a director of nursing, they've never really gotten anything for Nursing Week. Now, I have heard some who have said, well, we got a luncheon. They gave us a really good lunch one day. Okay, like, I'm not trying to be smart, but I think we all can buy our lunch. You know, sometimes I believe that the gift that somebody gives you, it kind of tells you, like, what they think about you. So, just want to tell you a little bit about what nurses do for those of you who aren't a nurse and are watching this. So, we work hard, okay? And a little bit of the nursing history is that years ago, back when they created the first nurse, Florence Nightingale, she was taking care of wounded soldiers, and the soldiers kept dying, and they couldn't figure out why are they dying. So as she was taking care of them, she decided to do some simple things. Open up the window, get a bucket of water, put some hot water, some bleach in there, mop the floor, and start cleansing the soldiers' wounds. And she started to speak to them and give them comfort and care, bathing them, providing first aid to their wounds, and they started to get better. And thus that created the first nurse. Well, as we all know, doctors used to make house calls, okay? And as the years went by, there was too many patients for one doctor to see. So they created a piece based off of Florence Nightingale. He needed like an assistant, and thus became the nurse. Now you would think that if he's writing the orders, because remember back in the day, the doctor would go into any facility, hospital, nursing home, or whatever, and you would hear, old-time nurses basically telling you, oh, we used to follow the doctor on his rounds, and when he wrote his orders, we would carry out the order in real time, whether that be take out stitches, hang this IV, give this medication, provide this wound care or whatever. But then as things progressed and it became more of a robotic profession, when it became more about money, when it became more about medicine and less about the patient, they don't get to do that anymore. So we work very hard. We carry out doctor's orders, such as, for myself in med-surg telemetry, I've done blood transfusions, I've started IVs, I've hung IVs, I've done head-to-toe nursing assessments, I've taken care of cancer patients, I've started PCA pumps, I've hung IVs for LPNs, okay? I have taken care of people who were basically having really bad rectal bleeds where they're putting out big baseball size blood clots, and I have to send them down to ICU. So you have to think critically, and you have to make decisions very quick. I've taken out sutures, etc., etc., etc. I've worked 12-hour shifts, I've worked 10-hour shifts, I've worked 8-hour shifts, I think I've worked some doubles. Okay. So at the end of every shift that I've worked, I've had to stay there for at least 30 minutes up to maybe 3 hours writing notes. So that just gives you like a little snippet of what nurses do. Now, people may say, well, you make a lot of money. To be honest with you, I really, really don't. You know what I'm saying? When I started my first nursing job in 2006, I came in making $53,000 a year. I did get an overnight differential at one of the hospitals I worked, which was $6 extra an hour. But when I realized what I'm actually doing, the doctor is not there. So the nurses are actually running hospitals, nursing homes, jails, psychiatric facilities, drug rehabs, home care, et cetera, et cetera. When you really realize that you're there functioning on your own as a licensed professional, where the money at? You know what I'm saying? These doctors are taking home like what? 175 to what? Maybe 300. I mean, surgeons a couple of years ago, maybe 10 years back, they were already at 400,000 a year. But then we nurses are coming in making 53,000. You do the math. The math is not mathing for me. I believe that in 2006, for what I was doing as an RN, I should have started at 100K a year, and for every LPN, she should have started at 70 to 80. Now that's just from my own experience. But let's move on. We've been taught to think independently and think critically and function on our own and run any facility on our own. Most facilities, according to state law and regulation, cannot open up. They can't even open their doors. A nursing home, for example, without at least one RN in the building. So that'll let you know how crucial I am. You know how many people I've pronounced time of death 4:45 a.m. and then I call the doctor. Okay, and then we call the coroner. The doctor didn't call the time of death. I did, based off of my skills. Okay, so let's move on. Nurses Week, 6.5 months ago. This one really made me angry. Okay, it made a lot of other nurses angry as well. Because guess what I got? And guess what I get every year for Nurses Week? So the facility will put up balloons and a banner, and it'll say Nurses Week. Most of the time when you see balloons in a banner, don't they throw like some type of party? Maybe you give out some awards, maybe some recognition, some type of medals, plaques, bonuses, money, a cake at least, at best. I mean, ShotRite cake is good. Nothing. You know what I got? Happy Nurses Week and an email. We appreciate all you do. Are you freaking serious? So how about we as nurses worldwide do a walkout, go on strike, okay? And say, we're not coming to work. We're not doing nothing else till you give us our flowers. How about that? But I never can get enough nurses on board to do it because we all are underpaid, okay? We're all underpaid. That's the LPN, that's the RN, that's the NP, that's the nurse anesthetist, that's the unit manager, that's the ADON, and that's the director of nursing. We're all underpaid, okay? Now, I know nursing assistants that make more money than me when they go through agency. I've worked alongside nursing assistants who from agency I'm only making $2 more than her an hour. I'm a whole RN. Are you serious? Not to discredit what she does. I was a nursing assistant. I was a home health aide. So I don't want us to get personal. I want us to stick to the point. So let's move on. I've gotten an email. All right. Let me tell you what doctors get for Doctors Week and Physicians Appreciation Week. They get awards. They get honorary awards. They get big plaques that have the gold in it that they can put on their office walls. I've heard they get bonuses. They get spa packages. They get elaborate luncheons. Okay? Guess what else I heard? I've even heard while I was at the dentist in Delaware one day, and I was telling them this, the dental hygienist said to me, she said, oh, I think maybe the Delaware Neurological Center, somewhere in Delaware, the medical assistants, every year, they get gifted a trip to an island for a week. So I think last year they sent them somewhere, maybe Bali, Belize, DR. That's the medical assistant. Not to discredit the medical assistant, I'm making a point here. Okay. Alrighty then. So we get emails and we're expected to show up to work and we're expected to do our jobs. So guess what I decided to do? I decided to start my own nursing trend called Gift Yourself for Nurses Week. But first, let me just show you what an employer gave me, okay? This last 2024 Nurses Week. Outside of the email, I think another employee, I think this was Delaware Psychiatric Center in Dover, Delaware. So look at this. We all know where this is going. It says positive. See that? Positive. Okay. So let's open it. It says think positive. I apologize. Let's open this up. See what this says. Alrighty. As you can see, I kept it in the bag. Guess what it says? It says, I am part of the nursing team. Therefore, I heal, I care, I help, I comfort, I strive for excellence, I make a difference. I put compassion touch into action lives. And on the back it says, your skill and cooperation always come through. My skill and my cooperation always come through. But I get an email. You're an asset, really. You think, what if all the nurses didn't go to work tomorrow? Can you imagine showing up to that hospital and you've had a tragic accident and she's not there? Just imagine that. And we're grateful for you. A mug, seriously? I'm a whole grown woman over here. Are you serious? And how many times on how many jobs are you going to get a mug? What I am going to credit them for, at least it doesn't advertise the company, because usually the mug advertises the company. All right, so let's see what else is in this bag. Let's see. Nurses Week 2024. Nursing Survival Kit. Nursing Survival Kit. Let's see. Candy. I'm not a kid. I got twin grandkids. Are you serious? My son is 20, my daughter's 30. Like, what are we doing here? Okay? I'm a whole RN over here. Like, what you doing? This is not what you do. So, it says lifesaver. You think? To remind you of the many times you've been one. Yep. Tootsie Roll. To help you roll with the punches of just not being compensated. Gotta roll with that year after year. Starburst for a burst of energy when you need one. You think after all the doubles and the 12 hours and the travel shifts and the overtime, can you stay or can you come in, Audra? Oh, they called out. Oh, you gotta work the cart because we're short. You think. Peppermint Patty to help you keep your cool. I think I'm about to lose it. Okay, I'm trying to keep my cool because I'm upset about this. Snickers, to remind you that laughter is sometimes the best medicine. You can't even laugh at this. It's a huge disrespect to all nurses. Okay? Gum, to help you get through this sticky situation. So I think they like throwing subliminal jabs at this point. You know what I'm saying? Because it's kind of like you know what we're going through. So anyway, as you can see, I'm not eating this. So that was an example. However, one of my fellow nurses, oh, she was so nice. She did give me something. And she gave me like this little gift set. And it's wooden, and I love stuff like this. I love this color, as you can see. So basically it says, thank you for being awesome. This says that, this says that, and so does the pen. For Awesome Audra RN. So I think that God was truly speaking to me. She gave this from the heart. I value this, and I really thank her for that. So getting back to me basically gifting myself for Nurses Week. That is the name of my trend that I started. Let's gift ourselves for Nurses Week. So I challenge all nurses, nurse practitioners, nurse anesthetists, unit managers, DON, supervisors, to gift ourselves for Nurses Week by saving $1 a day from one Nurses Week to the next or more. And so what I want to show you is, this is my Nursing Week envelope. And I started this after 2024 Nurses Week. I said, I'm going to gift myself. And so what I did was I started putting, you know, like $7 a week in it. And then I said, well, put a little bit more, Audra. So by 10/4/2024, I had $384. And now I have $498. $498. Not sure if you can see that, but I have that. And so we're only halfway to next year's Nurses Week. So I think I'm gonna give myself to a spa package at Utopia. I'm definitely probably gonna have a nice dinner. Definitely getting a cake. Definitely getting some balloons. But I also gifted myself for 2024 Nurses Week, and I wanted to share with you what I got. La la, Michael Kors, and this is one of my colors. Oh my God, I love this bag. I love this bag. Woo, I love this bag. And I wore this bag to a family reunion already. Oh, I love this bag. Okay, it felt good buying that bag too. I went back old school. I remember before I became a nurse and I was really low income. I think I only made like $8.41 an hour. And I would have to work overtime like every weekend just to have money to spend for me and my daughter. I would wear 9 West a lot, you know, when I got my check. And so this is, voila, 9 West. I normally don't even do like floral. But once again, these colors, they kind of go with my skin color. So love, love, love this bag. Love this bag. And then I also always like to give something that reminds me that I'm a nurse, and that basically puts a stamp on the fact that I am a nurse. You know what I mean? That's not an easy thing to be, you know, or an easy thing to do. But love, love, love this tote bag. Love this tote bag, okay? And I'm that type of nurse where I wouldn't use this as a bag to go to work, because all I'm going to do is stuff in it. It's going to get thrown to the side or in the backseat of the car, whatever. I would more so wear this, like, say I went out on a weekend just, you know, shopping or something like that. I would throw a couple things in it, you know, just to, you know, remind me that I'm a nurse, you know, and to look good and, you know, to feel good. And I also would use it as a beach bag. But anyway, that's my bag. And then finally, oh my God, I just had to go to Bed Bath & Beyond. We had to do the strawberry pound cake. Oh my God. Let me tell y'all, as soon as this video is done, I'm about to light these candles. Okay. They smell so good. So, I like for my house to be illuminated. So I brought 3 different types of the strawberry pound cake. I don't know if you smelt them before, but you really, 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 really got to try the strawberry pound cake. Oh my God. Just so, 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 so good. And once again, strawberry pound cake. So, finally, before I end this video, I hope you enjoyed it. I hope no one took offense to it. As you can see, Awesome Audra RN has gifted herself, okay, for Nurses Week, and I am well on my way to gifting myself for next year's 2025 Nurses Week. I'm going to do this every year. I have shared it with people on several jobs. A lot of people like it. They think it's a good idea. I would like for you guys to join in. If you have any ideas, about what we should do for Nurses Week, or you want to share what you do for Nurses Week, please comment below. I also want you guys to comment if you have a YouTube channel, a TikTok channel, a Facebook page, whatever you're doing to promote yourself, please share that, because I would like to support you as well. Finally, before I go, I just want you guys to comment on a couple of things. So one of them is, tell me, what is the meaning of Nurses Week to you? Number 2, what was 2024 Nursing Week like for you? 3, how did the appreciation of or lack thereof during 2024 Nursing Week make you feel? I know how it made me feel. I just was burning inside. And I think it's because it's been 18 years. I've never gotten anything for Nurses Week. Never. Finally, would you be willing to start your own Nurses Week celebration tradition? If you do, please share. Thank you so much, you guys. This is Awesome Audra RN signing off. Have a good evening. Goodbye.